Now, today marks World Diabetes Day. While more than a third of adults have prediabetes, 81% of those people actually have no idea. So joining me now to talk about what we can do to know our risks is Dr. Christopher Holliday with the Centers for Disease Control and Prevention. Thank you for joining us today.
Good to be with you.
So those are big numbers, and the idea that many people have no idea that they're walking around in this state is concerning. How would we even know?
Yeah, prediabetes is when a person's blood sugar is higher than normal, but not high enough for a diabetes diagnosis. And as you mentioned, 1 in 3 U.S. adults, that's 98 million U.S. adults, has prediabetes, and it's largely asymptomatic, and that's why they don't know they have it.
What's interesting and encouraging is that you can turn these things around, and it's lifestyle based. Can you explain how that works?
Yes, that's the good news, is that prediabetes and diabetes can be prevented or delayed with modest lifestyle changes. And so the CDC is partnering with the Ad Council as part of a continuing campaign, Do I Have Prediabetes? And releasing new PSAs, Be Your Own Hero, really encouraging adults to take charge of their health outcomes, particularly when it comes to prediabetes and diabetes, and knowing where they stand by going to doihaveprediabetes.org and taking a simple 1-minute risk test to know where they stand.
So what is it asking you on that? I mean, 1 minute, we've all got a minute. What is this thing asking you to answer?
Yes, so this is really around the risk factors for prediabetes. And so it asks questions about whether you have a sedentary lifestyle, whether you might have added weight, whether you have a close family member that has type 2 diabetes, your mother, father, sister, or brother. If you're a woman, whether you've ever had gestational diabetes. These are all risk factors that could put you in risk for prediabetes, and you'll get a score after that 1-minute risk test. And if the score is high enough that you may have prediabetes, we just ask that you connect with your healthcare provider and have a confirmatory blood test to determine whether you in fact do have prediabetes.
Would you give us that link again, where to go to take that test, please?
Yes, the link is doihaveprediabetes.org.
That is the best website ever for something like this. It cannot be easier. The test is quick, and the answers could really change how your life feels over the next couple of decades. Dr. Holliday, good luck with this. Thank you very much for joining us today.
Thanks so much for having me.